Hi everyone, today I will be talking about the second part of the project that we've been doing this semester, the Multimorbidity Index. And so just a little bit of history behind multimorbidity and the concepts along with the indexes. So in general, multimorbidity is living with two or more conditions. So this happens between those who are usually over the age of 50 and it's just living with conditions that could possibly decrease your mortality rate. So, with a little bit of background behind it, there are a few PubMed articles that discuss measuring multimorbidity, and some of that consists from like doing simple counts from like normal morbidity indexes such as Charleston's. And then there are others that include weighing or including chronic conditions, thus creating a weight index of multimorbidity. And then there's the ACG, which is characterizing multimorbidity, which is a little diagram that's created to determine the weights of multimorbidity. And then with the indexes to help more multimorbidity, there are two of them. There's the multimorbidity index, which is found in those links, and then there's a different one called multimorbidity weighted index, which focuses more on the weight of the conditions, and then from there being able to determine the mortality rate. Next, we are given some data, and so these are some of the patients. From what we did in the first half of the semester, we were able to clean it already, and so this is the data given that we are going to use for the analysis of finding the accuracy, likelihood ratio, and other sorts. And this helps us because this gives us the LR and then gives us other information to help us determine the accuracy. Next, this is the likelihood of mortality in 6 months. We are able to do that through decreasing the specificity of the ICD-9 codes. So once we are able to do that, we are able to determine the weight of the morbid or the condition. And because there are so many ICD-9 codes, we decrease the we make the ICD-9 codes more generalized so that we are able to determine it a lot more quicker and a lot more efficiently. Because if we went through each ICD-9 code with what it is and determining the weight of that would be a little complicated. So because the multimorbidity index only has about like 50,000 ICD-9 codes at the moment, we are able to we're able to generalize the ICD-9 codes through erasing and deleting the decimal points that we have on the ICD-9 code. So the more general lists, such as like having like just regular 294 or having just 276 or ICE 276, this allows us to have more generalized ICD-9 codes, which allows us to have the likelihood of mortality in 6 months for patients. Next, we are going to talk about the body system progression and how we were able to use this as like a marker of progression. So what we did in this one is we were able to categorize different ICD-9 codes into body systems, and from there we were able to determine what specifically in each patient the most risk of mortality is. So as you can see on the left side, we have the different body systems, and then on the right side, we use the code to determine the predicted weight for each individual or for each patient. And then from there, we were able to determine how the index scores multiple diagnoses within like the same and across the body system. So from there, we're able to determine like the ID, the ICD-9 code, and then the age of when it was first diagnosed, along with the age of the first or the age of death as well. And so from there, I used the ID of 196181, and from there I was able to create a progress and like the progress that the patient had before they passed away. So as you can see here, they have a lot of skin ICD-9 codes going on, as well as illness. And then as you can see forward, when the patient comes in again at the age of 83, this is their second visit, it increases. And then visit 3, when they're about 83 and a half years old, that's when they pass away. And this is like their progress through that. And from there, you can determine that the patient has a lot of blood disease ICD-9 codes going on, so this allows us to be notified on what was going on with the patient and why the patient may have passed away. But going back to the accuracy of this, we are comparing the multimorbidity index, which is what we used in the second half of the semester, versus the Charleston's index, which was used in the first. As you can see, the multimorbidity index gives us an area under the curve at 0.86, which means that it is 86% accurate, while the Charleston's index was around 60% or 0.06, which allows us to determine that the multimorbidity index is a little more accurate rather than the Charleston's index. And so this leads us to the conclusion of the multimorbidity index being better and more accurate than the Charleston's index because of the higher accuracy, and allows those who have multiple existing conditions at the same time to be determined and to determine the mortality rate. And it creates a more realistic data to allow the patient, or not only the patient, but the doctors to understand the mortality rate and better ways to help support the patient. Thank you so much for listening to my presentation.